So this video is talking about all you need to know about Streptococcus infection. What is Streptococcus infection? I'll be talking about that. Symptoms of Streptococcus infection, how to prevent Streptococcus infection, and management of Streptococcus infection. What is Streptococcus infection? It's under the class of bacteria. Alright, so Streptococcus is under the class of bacteria, and it can simply be cured with antibiotics as usual for every bacteria issues. What are the symptoms of Streptococcus infection? You'll be having fever, you'll be having nausea, you'll be having vomiting, you'll be having weakness, tiredness, body ache will be playing a role. So whenever you're having Streptococcus infection, this is just like a differential diagnosis to other cases, but it does not mean that with these cases then you are 100% having this infection. It can be a differential diagnosis, so you should check that out and clarify from your medical practitioner. All right, now let's go to prevention. Prevention is just normal for every medical cases. Be conscious, wash your hand often with soap and water, and you should remember that during the winter Streptococcus can spread more rapidly compared to during the other time of the year. So you should know about that, and you should try to be conscious with who you share your glasses with what utensils you use in eating, who you share with, and etc. And you should also be conscious of keeping yourself clean and neat, and bacteria will stay away from you. So that is the normal prevention which we have, and it's always working for us, right, from medical field. Right, now talking about the management, we can't go into giving somebody medicine without talking about diagnosis. So diagnosis is very important. So how do we diagnose Streptococcus infection? We can diagnose Streptococcus infection when we go to a lab. The lab technician will do either they are doing a throat swab or they are doing antigen fast diagnosis. There are other diagnoses which is associated depending on what your doctor is recommending to you. So they can just use some stuff put in your throat to take some like, let me say, some sample. All right, then they will take it to the lab and to check if this is having same antigen. All right, so apart from that, coming to the management, we all know that antibiotic is the treatment, but you should know that if your Streptococcus is more than what it should be, like let's say 24 to 48 hours should be the acute time limit. So if it's more than 24 to 48 hours and you're having some referred issues, like, because Streptococcus can spread and it can cause some issues to the mid-ear, or it can cause some issues to the sinuses, or some issues to the tonsils and etc., or damages, or I saw a video someone was amputated due to Streptococcus infection. So you know the management would increase above what you should have gotten originally. All right, so the management, you need to be admitted to the hospital, to intensive care unit, so that you will be managed properly. All right, so that is the management for Streptococcus infection. Thank you for watching and have a very nice day.